Hey guys, this is Dr. Adam Wheeler. Let's talk about testosterone. So it's going to be kind of longer form as it's a very nuanced topic, and I want to give it a bit of justice. This is after kind of my deep dive into the subject and some experience with the subject over the last, I'll call it year or so. I was initially anti-testosterone use for men. So I'm now a convert, and I'll explain to you why. So I think one way to think about the testosterone is to, rather than thinking about it of what is normal, question mark, is to think about it as what is optimal. So what does normal mean? So normal is a statistical term, and let's say we're going to use between the 5th and 95th percentile is normal, right? So you can have a normal height for men. 5th percentile for men is about 5'4", 95th percentile is about 6'1", 99th percentile for height is about 6'4". Okay, so what is normal? Okay, for testosterone, for a 50-year-old guy, the 5th percentile is about 250, and the 95th percentile is around 800, right? Depending on what data you use. So, the question though is not what should your testosterone be? And this is how the Endocrine Society and various people approach it. They're like, well, if it's not causing dreadful symptoms that might kill you, then we probably just shouldn't address it, okay? My question is different. So Big Tree is a patient-centered clinic. And so I want to ask, how can I help people do their best, right? And what is really fascinating is testosterone fits in this really interesting place where I think of it more as a performance enhancer for life rather than as a fixing a deficiency state, okay? So much like I use caffeine as a way to do my job better, what if we had a substance that the body made that if we bumped you into the 95th or 99th percentile would make you feel better, perform better, and act better? This would be something like if life were basketball, right? And the most important thing on earth was how you did in basketball, right? And I could give you something that made you in the 99.9th percentile for height, right? You're going to be better at basketball, right? If you look at the average height in the NBA, it's something like 6'8", right? Which is well above the 99th percentile. And so if the only question on earth was, how are you doing basketball? And I had something that would make you better by making you taller, then it would be meaningful to bump you into the 99th percentile as a way to make you function better, okay? Assuming there were no serious downsides or downsides that I didn't think were worth it. And so this is where with testosterone, look, the reality is a lot of guys feel better, act better if they're hanging out in the 90 to 99th percentile for testosterone levels, right? Getting them up there in the 800 to 1,000 range. The Endocrine Society says not to do that, and there is, to be honest, very little data on synthetically pushing levels that high. Now, Big Tree, we use biosimilar testosterones, and so we're putting testosterone in your body, and then we're elevating your testosterone level, typically into the 90th to 99th percentile for your age. There was some old data that questioned this about, is this increased your risk of heart disease? That data has been largely disproven. There's one study left out there that showed that in a group of 21 men who had levels around 1,000, that they had a slightly higher increased risk of heart disease. So that study is out there. I'll tell you, for me, I'm 47 and I've been on testosterone for, 8 or 9 months, and it was life-changing. I knew it was life-changing because I initially did the shots, which we do prescribe here, and we have them in our pharmacy. Usually it's hard to get sometimes. And they usually last about a week. And I would forget to get my subsequent dose. So I'd give myself my shot, and then a week would go by, and I'd forget. And day 8 or 9, I would find all my fatigue, my anxiety, my brain fog coming back, okay? And finally I went and got the pellets, which we use the BioT program here at Big Tree. We're one of the top BioT providers in the Midwest, and got my levels up, 99th percentile for age, and it's been completely life-changing. So things I've noticed are, I used to have to nap all the time, and I stopped napping. Now my levels went from the below the 5th percentile to above the 95th percentile. Okay, that's the change I saw. But we often see guys who are even lower in the 350 range, right, which is like the 25th percentile. We bump them up to the 800 or 900 range, and it's just a life-changing experience. Am I getting jacked? No, I don't lift a lot. That's not my goal. My goal is to help with the brain fog and the fatigue, and it's completely fixed those problems for me. But a lot of other changes in my life too, but especially my experience with the shot, where it would wear off and I would feel it. I'm really confident that testosterone has been a huge impact for me. So much so that if I were going to rank for people, not just guys, top 3 or 4 things you could do to transform your life in middle age, I'd probably put exercise as number 1. I'd probably put testosterone management as number 2. And then I'd put social interactions as number 3. And I'd probably put nutrition, eating whole foods, as number 4. So, it's up there, right? So that's true for women too. Yeah, it is. So talking to our guys that do a lot of this, which a lot of our team does now, we are the hormone that impacts a lot of the perimenopausal stuff that you're seeing a lot about on social media is testosterone. And so for women, no, we're not bumping levels to 1,000, but we'll see women who have levels of undetectable, or 10 or 25, and we're bumping those women into the 150 range, and we just see a dramatic improvement in the brain fog and the fatigue. It's often associated with perimenopause. We like the pellet system the best for a few reasons. It's not perfect, and there are people who like injections better. We're comfortable with either one. We also have the topicals, and we actually have the troches too that we can get. So we have all the options. For all the options, testosterone therapy, think of it as about $1,000 per year at Big Tree. So for women, it's around $250, and they do it every 3 to 4 months if you're doing pellets. We don't typically do injections in women. And then for guys, the pellets last 5 to 6 months, and it's $400 to $500 depending on the dose. So think $1,000 a year. Labs are a little extra. We probably do a couple $100 in labs at the beginning, and then a smaller lab set to follow up. So you're thinking all in $1,000, $1,200, okay? Plus your Big Tree membership. This is a Big Tree member program. So not cheap, but for life-changing for so many individuals. So this is controversial, right? And I think it's controversial because big medicine is not about helping you feel better. They're about billing your insurance, right? You as the patient exist because you're needed for big medicine to bill insurance. And insurance doesn't like to do things just for the sake of making you feel better. And so they see this as a useless expense. So Big Tree exists to help our members, right? So we're a patient-centered clinic. So for us, we're like, well, how can I help you feel better, right? And the answer is testosterone is a really great way to do that. So I don't really like to think about this as replacing a deficiency. There are some people who are testosterone deficient. We've tested guys that were 0. But this is more of a human optimization thing, right? How can I get you feeling your best with something that, as far as we can tell, is super safe? Are there lots of studies on testosterone levels of 1,000 being done artificially, and that No, there aren't. Okay. We're starting to think about treatments in a what I call green, yellow, red. So red are things that we're like there's no data and this could be potentially harmful. Green are things that are like solid, FDA approved, mainstream medicine does it. And then yellow is kind of this middle range. I would put testosterone here, maybe yellow to green, but it's yellow where I wish there was more data. But it's so life changing for so many people, and the data we have is so good on the safety is good enough for me that I think it's worth it. We do have lots of data on men whose levels are naturally at 1,000, and they have lower risks of Alzheimer's and higher rates of all kinds of good things. So, and we're giving you a bioidentical hormone, right? So the logic there, which should be studied and hasn't been, but the logic is that we're giving you something that exists anyway. We're putting you, it's like creating a 6'8" man in a basketball league. We're doing this artificially, but it makes you perform better. So, love to chat with you about this more. Happy to check levels, of course. Just message us on Spruce, and we will get you set up to have a conversation.